As a fertility specialist, sometimes I come across patients who turn up for fertility treatment rather too late, when their fertility has declined and even the success rate with treatments has declined. So today I thought, let me make a video on how to know about female fertility early. So I am Dr. Prachee Kulkarni, fertility specialist, Ferty9 Fertility Center, Banjara Hills. Let us see the symptoms which may tell us about declining female fertility early. So number one symptom is related to your menstrual cycles. Having irregular cycles, having too frequent cycles like less than 25 days, or sometimes too long duration cycles like bleeding more than 7 to 8 days can be a symptom where you need to look into the cause by visiting a fertility specialist. Rather, long cycles like coming after 2 months, 3 months, sometimes even after 6 months is also a symptom which needs attention. So irregular cycles can be cause of polycystic ovary, or it can be also a cause of having very low egg reserve. So rather than assuming anything, it's always better to consult a fertility specialist if you have irregular cycles. Second symptom is having very heavy bleeding or passage of clots during menses, or having very low bleeding like scanty bleeding, soaking one or less pad per day is also abnormal. Having heavy bleeding may mean you may have certain uterine pathologies like endometrial polyp, which goes inside the uterine cavity and causes excess bleeding, or having fibroids, which are benign tumors of the uterus, which may be present in the wall of the uterus or sometimes even pressing inside of the cavity. So these are the causes of heavy bleeding during cycles. The causes for low bleeding can be damage to the lining of the uterus. This may occur due to past infection or any history of DNC or MTP where the cavity has been curated. So what happens is there is permanent damage to the lining of the uterus, which results into the less flow during bleeding. So if you have very heavy bleeding or very less bleeding, that is also a symptom where you should take medical advice. So now coming to other conditions. Medical conditions like hypothyroidism, or having problems with prolactin levels, or having breast discharge which is like milk in color, or other issues like diabetes mellitus, blood pressure, having high levels of cholesterol, having deranged liver function or fatty liver, all these conditions, it affects your general health as well as your fertility. So if you have any medical condition for which you have to take regular medicine or you have to consult doctor, then those conditions also may play role in your fertility. So somebody who has medical conditions also should consult the fertility doctor earliest. So these are different medical conditions. Now coming to other history, like somebody has history of cancer which is being treated with chemotherapy or radiation therapy, or somebody has autoimmune conditions like SLE or rheumatoid arthritis where they are required to take certain drugs which may also reduce your fertility. The autoimmune conditions itself, by producing autoantibodies, can result into decreased egg reserve in such females. So if you have any autoimmune conditions, then also you should consult the fertility specialist earliest. Other reasons can be any history of surgeries in the pelvis, like any ectopic pregnancy, any ovarian cyst which has been removed, and most important is history of endometriosis. If you are the one who's been operated for endometriosis, then you should take your fertility as priority, because endometriosis is such condition where it may reoccur and it may also become more severe with the time. So if you have been diagnosed with endometriosis, or if you have undergone surgery for endometriosis, your fertility should be your priority. So in all these conditions, we need to consult a fertility specialist to know your egg reserve, to know the reasons for infertility. Once you have the diagnosis, either you can consider going for fertility treatments like ART, like IUI and IVF. If you are not planning pregnancy immediately, or if you are not married, then in such cases, we also advise to go for egg freezing. Egg freezing is like a boon to women who want to postpone pregnancy for any reasons. So when you freeze your eggs at a younger age, egg freezing will help you becoming pregnant at later age when you have increased risk of miscarriages due to age. Somebody who has frozen her eggs when she is less than 30 years and plans a pregnancy after 35 years will have the same risk of miscarriage as a 30-year-old. So it can also reduce your risk of miscarriage having genetically abnormal child if you freeze your eggs at a younger age. So this was about how to know the fertility issues earlier. I hope this was helpful. Thank you.